Okay, welcome to Olive Nurses Academy. Let's continue our revision section. Okay, so endocrine disorders. So already we have seen the endocrine disorder. Now we are going to see the question answer section. So everybody, I have told you already, this is all revision class to you to practice. Okay, so concentrate and try to read the question with me and answer it in the chat box. Nobody going to see who is right, who is wrong. Okay, it is you to practice. That's all. Okay, we'll move on. We have so many questions, so try to be fast. Okay, first question. Read the question and try to answer. Okay, sorry. A client is admitted to the emergency department and diagnosed of myxedema coma is made. Which action would the nurse prepare to carry out initially? Use the chat box to answer. Warm the client, maintain patent airway, administer thyroid hormone, and administer fluid replacement. Which one it will come? Try to answer. If it is correct or wrong, no problem. Okay, everyone. Okay, always remember you have to take the key point from the question. Okay, what is the myxedema coma? It is severe hypothyroidism will cause the myxedema coma. We have already seen in the endocrine system. They have mentioned you emergency department. Okay, so what is the priority here? This 4 will be the priority. Okay, so remember this 4 will be the priority, but they are asking what is the initial. So always remember ABC. So emergency situation, that should be the maintained pattern airway. Okay, got the point? Okay, we'll move on. Next one. Okay, some big questions only there, but try to be read, okay? Because now itself you have to practice for the 210 question. The nurse is caring for the client who is 2 days post-operative following the abdominal hysterectomy. The client has history of diabetic mellitus. If you're not able to read, I'm reading, okay? So follow me. The client has a history of diabetic mellitus and has been receiving regular insulin according to the capillary blood glucose testing 4 times a day. A carbohydrate control diet has been prescribed, but the client has been complaining of nausea. Okay, remember nausea and it is not eating. Okay, and entering the client room, the nurse finds the client to be confused and diaphoretic. Which action is the appropriate at the time? Okay, here you have to remember diabetic mellitus patient only. So they are taking the blood glucose level and carbohydrate control diet also, but patient having nauseated, so not eating. Now suddenly the nurse is entering into the room. There is a complaint of the patient is confused and diaphoretic. What is the nursing responsibility? What is the action? So first one, call a code to obtain needed assistance immediately. Second one, obtain the capillary blood glucose level and perform focus assessment. Third one, stay with the client and ask the nurse assistant to call the physician for the prescription for the intravenous 50% dextrose. Fourth one, ask the nursing assistant to stay with the client while obtaining 15 to 30 gram of carbohydrate snacks. So what will be the answer? How to just think about critical thinkings, okay? Anybody? Okay, I'm just coming down to up, okay? So why we are discussing the question, then only you can able to know how to just answer the question, okay? So that's why some questions I will be doing slowly, okay? So here the fourth answer, see, ask the nurse assistant to stay with the client while obtaining 15 to 30 gram of carbohydrate snacks for the client to eat. Okay, here no nursing assistant, okay? Here they just ask you who is entering. Nurse is finding the patient, okay? Only nurse and the patient is there. So here no nursing assistant in between. Okay, so don't leave the point, because when you call and come for the nursing assistant, that time you will wait. No. So third point, see, stay with the client and ask the nursing assistant to call the physician for the prescription for the intervention. So as we remember, as we know, hypoglycemic attack, it will come emergency time. You have the standing order. You can give 50% dextrose, right? That will be the standing order. No need to call and ask for the physician under. Okay, so that will be also wrong. So first of all, what you have to know whether it is hypoglycemic attack or not. So you have to check first what. Sometimes very easy question answers. Okay, sometimes we will you think so much, but the answer is very easy. What is the answer? Now you know. The second is the answer. Obtain the capillary blood glucose level. So according to the blood glucose level, you have to relate. So you have to relate with the patient. So if it is the 50 only, if it is the blood glucose level 50 or 60, immediately you have to be patient is confused. So you should only give the IV 50% dextrose. Okay. So if it is not, if it is above 75 or 80, something like that, you have to be treat the another clause. What is the another clause we have to look for that? Okay. So we have to remember that first is obtain the capillary blood glucose level and perform focus assessment. 2 is the answer. Got the point? We'll move on. So always take the answers from the question. Okay. So next, client with the type 1 diabetic mellitus, call the nurse to report recurrent episode of hypoglycemia with the exercising. Which statement by the client indicate inadequate understanding of the peak action of NPH, insulin and exercise? Okay, what is the NPH insulin? It will be the intermediate action. Okay, intermediate action will be that. So here, read the answer properly. So they are asking which will be the indication of the inadequate understanding of the insulin and the exercise, related to exercise and the insulin. So something the patient is telling wrong. That is the answer. Okay, read the question properly. First is the best time for me to exercise is after I eat. It is correct or not? Yes, after the eating only, because before eating, if they go into the hypoglycemic attack. Okay, so the best time for me to exercise is after breakfast. Then the best time for me to exercise mid to late afternoon. The best time for me to exercise is after my morning snacks. What will be the wrong answer? Wrong answer, it is the answer for this question because they are asking inadequate understanding of the patient. They can eat already the exercise about insulin. You have to remember diabetic patient always they have to take some snacks or some food, then only they have to do some exercise. Because if they not eating and doing exercise, what will be happen? There will be the hypoglycemic attack. Okay, that is already insulin going on. So insulin will be regulate, okay, reducing the blood glucose level. So with that, you will do the exercise also. What will be happen? The patient will be collapsed. Okay, so you have to remember. So first is after I eat is correct. After the breakfast is correct. After the snacks also fourth option is so correct. But after the exercise, for me to exercise mid to late afternoon. There is no teaching like that, mid to late afternoon. Okay, that is the wrong answer. So you have to choose 3 is the wrong answer. Got the point? Hope you understand. These are the different type of diabetic mellitus questions. Okay. So 3 is the answer. We'll move on. Next one. Health teaching to the diabetic patient will be on. Okay, this is the community health nursing related question. So I have just cut down the short form. Okay, because it is the big question. It is about the community health nurse. It is visiting to the home of the diabetic patient. So what will be the health teaching will be given for this diabetic patient. That will be the question. So what will be the diabetic patient teaching? I have told you already the 4 option will be correct. You have to select which one will be appropriate, which one will be best, okay, which one will be priority. Like that you have to choose. So here if you see all the options are correct in the diabetic patient, but you have to select, they are just simply giving diabetic patient without anything in the question. You have to take the answer. So in the question they specifically mention complication like food ulcer something, you have to take the answer about complication. Okay, so otherwise then the patient is taking insulin, if they mention that, you have to take the option insulin. Okay, so first you just come from the down to up. Okay, so about complication here they didn't mention complication, so just leave that answer. Next one, Okay, because why I am discussing this type of question, most of the question is like that. You will confuse because the four answer is correct. So how you will choose? Okay, remember that. So from the question, you have to take the answer. So complication they didn't mention. So cut down that answer. Okay, next one. So remember, they have to be just any, they didn't mention you any insulin, right? They didn't mention any insulin. So you can take out the B also, option B. Diet, insulin, exercise, feeding. The patient is not taking insulin. They didn't give in the question. So you can take out B, B answer, T answer, not come. Okay. So what about the A and C? How to find out diet, hypoglycemia, exercise, feeding. Okay, so these all will be needed for the patient will be having the diabetic mellitus. But here A option C, weight loss. Did they mention you the patient is obese? Obese? No, right? Or any high BMI? They didn't mention you. So no need to take weight loss here. So answer is C. Like that only you have to concentrate and take the answer from the question. Got the point? So diet, hypoglycemia, exercise, feeding. These are the normal teaching you can tell for the diabetic patient. If they specifically mention any food ulcer like that, about complication, how to give. If they specifically mention BMI is high, patient is obese, you have to come for the weight loss. Other than that, no need to select that. So here the answer is C. Okay, we'll move on to the next question. Okay, these all already seen in the endocrine. Why you are not answering? Try to answer, everyone. A nurse is teaching a client how to mix the regular insulin and the NPH insulin in the same syringe. Which of the following action, if performed by the client, indicate that need for further teaching? Okay, always remember these are the questions very common. Need for further teaching, need for further teaching. What is mean by that? Patient telling something wrong. That is need for the further teaching of the nurse. Got the point? So you have to select which one patient is telling wrong. That is the answer here. Okay. So which one is wrong? NPH is cloudy. Okay. Regular injection will be clear. So what you have to do? First, we have to load the clear and we have to load the next is NPH. We should not first cloudy, we should not administer. Okay, we have to withdraw first clear, then cloudy. Clear plus cloudy, we can mix. Got the point? Okay, now what is the answer? Read it. Withdraw the NPH insulin first. Withdraw the regular insulin first. Which one we should be the first withdraw? It will be the insulin of the regular insulin withdraw first. Okay, that is the first answer. So inject the air into the NPH insulin vial first. I think hope you remember the points. Okay, nobody answering. So inject the air into the NPH insulin vial first. Yes, first we have to be just, I will tell you the answer. Okay, somebody answer at last. Okay, so just remember in the NPH it is cloudy. Okay, the insulin or rather regular insulin it is clear. Okay, so what you have to do, take the insulin syringe, you have to just push the air first into the NPH. Okay, inject the air into the NPH first, then it should be inject the air into the regular insulin. Then as you inject the air, you just tilt like up and down and we have to withdraw for regular insulin. That is the clear one. Then we have to be take out and just in that aspirate the withdraw the NPH insulin second. Okay, that will be the correct. So here inject the amount of air equal to the desired dose of insulin into the vial. Okay, so these all will be the correct because the inject the air into the NPH insulin first, it is correct. But the withdraw the NPH insulin first, it is wrong. So A is the answer. Okay, only one number answer. So everyone try to be answer. Okay, this is you to practice. I know something you understand or not. Okay, so answer is 1. We'll move on to the next one. So here I have given you answer already. So just remember, I will be telling you the situations here. Okay, so 60 years old diabetic man, there are so many questions from diabetic. Okay, so don't ignore. So try to be understand. 60 years diabetic man maintain a simply daily insulin regimen. Okay, getting the insulin. Okay, he inject a mixed dose of regular insulin with the intermediate, that is the NPH plus the regular mixing, and they are using before breakfast every morning at 7 hours. Okay, that is a 7 a.m. Okay, then goes to the work. His lunch is at 12 and dinner at 7:30. Okay, so sorry, 6:30. 18:30 means 6:30. Also eat snacks before he goes to the bed at 21:30. Okay, he reports feeling confused, dizzy, and faint during for the short time every day. Which blood glucose level are most likely during the symptom? They're asking during the symptom, what will be the problem for the patient? During the symptom, what will be happen? They are injecting regular and the NPH. Okay, regular will be act quickly, but the intermediate action will be in the mid time. Okay, it will be act in the mid time. Okay, so what will be happen? They are when they confuse or dizzy, fainting, there is an insulin level increase, glucose level decrease. That's why they are having the hypoglycemic attack. The confusion, dizzy, faint under will come under hypoglycemia. So insulin increase, glucose will be decreased. They have to go to the hospital and maintain the correct insulin level. That is the management. So they just asked about the blood glucose level will be how will be during the symptoms. So increase insulin, decrease glucose. Okay, got the point. We'll move on to the next one. Okay, so here one of the key point, the glucopage. Okay, so what is the glucopage? That is a metformin tablet. Okay, metformin will cause lactic acidosis. That's why it will be cause the lactic in the blood will be so much of lactic acid will become. Okay, if the patient is taking metformin, that's why during the surgery, okay, during any surgeries before and after 48 hours, we will be withhold the metformin because it will cause lactic acidosis. Got the point? Okay, next question. Elderly patient with a long history of diabetic mellitus come for the routine checkup. Which of the following nursing diagnosis would the nurse anticipate? Read the nursing diagnosis and try to answer. Diabetic patient. Routine checkup. Risk for impaired skin integrity related to the decreased sensation and circulation. Excessive fluid volume related to disease process. Risk for injury to decreased gastric mobility and stress response. Deficit fluid volume related to diarrhea and loss of fluid. So which one will be appropriate? They have just told you here the history of long history. So what is the what will become long history of diabetic mellitus? There is a chance of complication. So if you know the complication of diabetic mellitus only, you can able to answer this question. What is the complication teaching we will give? Diabetic foot care, right? Why we are giving diabetic foot care? There will be the patient will be having the sensory loss, peripheral neuropathy. So there is a nerves will be no sensation. That's why if they just hit to the heel, anything, they won't have any feeling of the sensation. That's why we are giving the patient to the that teaching foot care and all. So what will be the risk for impaired skin integrity? Very good. Related to the decreased sensation and circulation. Okay, got the point. Other than that, nothing is compared to that. Nothing will be come. Okay, because no hypoglycemic attack, no hyperglycemic attack. So long term, there is a chance of impaired skin integrity because of decreased sensation and circulation. A is the answer. We'll move on. Okay, if you know that's a when I'm taking the disease condition, I will tell you what is the disease. If you know, you can able to answer the different type of the situation question. A 45-year-old patient has had the difficulty in sleeping and has lost 10 kilograms. Okay. So despite having the large appetite on examination, there is a palpable thyroid gland. Blood pressure 108/58, heart rate 106, respiration is 22, temperature 38, oral temperature, okay, height is 164, weight is 50 only. Which additional symptom most likely? So what is the disease condition? It is difficulty in sleeping and there will be the large appetite, palpable thyroid gland. It is most likely hyperthyroidism. Okay, so symptom is related to hyperthyroidism. There is so much of craving to food, okay, large appetite, but they are not getting the weight. Okay, weight loss is there for the hyperthyroidism, hypermetabolism happening. Okay, so what is the next symptom will come? Depression will come? No, depression will come for the hypo patient. anorexia, paresthesia, all will come for the hypo patient, hypothyroidism. So heart palpitation, okay, heart rate will be increased for the patient with the hypothyroidism. You have to relate and see the heart rate here also 116. Okay, so heart palpitation is the answer. So A is the answer. Okay, so we'll move on to the next question. Try to answer the question. These are all related to most of the question from the diabetic mellitus in endocrine. This is the large system endocrine. So concentrate. The client is taking Humulin NPH insulin daily every morning. The nurse instruct the client that the most likely time for the hypoglycemic reaction. When will be the hypoglycemic reaction for the NPH patient? When will be the peak time for the action? That is the hypoglycemic attack, because the insulin will be reduce the glucose level. Okay, so peak time will be reducing suddenly. There is a chance of hypoglycemia. Remember, so NPH is intermediate action. Okay, so regular insulin peak time, it is 2 to 4. Intermediate insulin peak time, it is 4 to 12. Okay, so that will be the peak time. So what is the answer here? 4 to 12 hours after administration of NPH insulin, there is a chance of the hypoglycemic attack. Got the point? Okay, so that will be the peak time. So you have to know the peak time also. Okay, during the endocrine, I have told you the peak time. Don't forget. Okay, 2 is the answer. We'll move on. Next question. Home health care visit a patient who is newly diagnosed with the diabetes. The glucose level ranges from the 120 mg to 150. Okay, while currently glucoside that is HbA1c. Okay, it is 6.9%. The patient is compliant with the taking prescribed hypoglycemia medication and eat 3 meals a day, followed by the dessert sweetened with the granulated sugar. The patient also exercises 30 minutes a day, 3 times a week. Which of the following education intervention take priority? All seems to be normal, right? What will be the answer? Find out. Okay, one member's answer. Everyone try to answer. Okay, very good. Dietary requirements. Okay, they are already taking dessert sweetened with granulated sugar and all. So we have to teach the diabetic diet for the patient. That is the important priority teaching for here, because already exercise regimen they are maintaining only. Okay, glucose monitoring also they are doing. Okay, so they are taking the hypoglycemic medication also. So what will be the here the missing? It is dietary requirement will be needed for the patient, because patient already taking eats 3 meals a day. What is actually for the we will be giving 6 meals for the patient. Small frequent diet for the patient will be diabetic 6 meals. Okay, because 3 meals, 3 snacks we will provide. So we have to educate about the dietary requirement. Okay, we'll move on to the next question. You can able to answer, right? Okay, very good. We'll move on to the next one. 62 years old diabetic type 2 patient admitted in the hospital for the ambulation of the right foot toe. Okay, maybe it's a gangrene. Okay, so the gangrene and ischemia. So pre-operatively, the patient rate, the pain is 9. Okay, how can this patient phantom pain best be controlled? Phantom limb pain. Have you remember? We will be studying in the patient with the endocrine system, right? So phantom limb means that will be after the removal of the preoperative, there is a 9 score. Okay. So phantom limb pain out will be controlled, they are asking. Post-operative elevation of limb or apply the pressure bandage to the thumb. Control pain preoperatively, apply ice to the site of the for the 20 minutes. What will be the best P to control? They are mentioned already. We have to be pain is 9 in the preoperative. Okay, so control the pain preoperatively will be helpful for the phantom limb pain in the postoperative time. Okay, you have to remember. So how we will control? we will be doing the mirror therapy. We will be doing the some of the analgesic administration. Okay, so that will be the answer. But here, what they are mentioning, you have to control the pain pre-operatively itself. Then only post-operatively, there is no much pain. Okay, so there is no much sensation about pain in limb. Okay, so because the mentally they are fixing, there is a limp is there, so I will be getting the pain. Okay, because pre-operatively I have so much pain. So post-operatively, definitely I have so much pain. There is a mentality. So they having without limp also pain. So pre-operatively, you have to treat the pain. Okay, so answer is here, no elevation of limb. We should not elevate, we should not bandage them. Okay, that will be the pressure bandage. After the dressing, after the healing, we will do. So that won't be come under the pain control. And applying ice and all won't come. So C is the answer. Okay, control pain pre-operatively. Okay, some question also easily you can answer. Okay, next question. Okay, read the question. What would be the long-term management goal for the patient with the diabetic mellitus type 2? What is type 1? Insulin-dependent diabetic mellitus. Type 2? Non-insulin-dependent diabetic mellitus. Okay, so remember that and answer. Long-term management of diabetic mellitus type 2. Okay. It is nothing but if you read itself, you can able to identify. No insulin come for the type 2 diabetic mellitus mostly. Okay, so what will be the answer? Quickly lower blood glucose level by administering insulin, not come. Okay, achieve hypoglycemic state. There is no related answer. Okay, achieve hypoglycemic state, no, not come. Okay, so it will be maintain blood glucose only. So next, maintain daily exercises. They can do with the long-term patient to reduce the complication. They can maintain the daily exercise. Okay, understand how to self-administer Mullaks. So that will be also, it is under the insulin. So it won't come. So C is the answer. Okay, very good. We'll move on to the next one. Patient to have an elective surgical procedure to repair the umbilical hernia. Patient is 68 years old, weight is 136, and the diabetic mellitus. Which of the following approaches would be the most beneficial in order to reduce the surgical risk? Diabetic mellitus patient, okay? Monitor blood glucose level monthly, avoid fluid overload, and discourage any changes in the routine before surgery. Encourage the weight reduction, which will be the reduction of the most beneficial order to reduce the patient's surgical risk. Always take the answer from the question. So there is a weight is 136 kg. So there is so much weight, right? So the weight reduction will be the reduce the complication of surgery. So encourage weight reduction. It is the answer for this question. Okay, D is the answer. We'll move on to the next one. "28 years old male is recovering from the moderate concussion following the motor vehicle accident 2 weeks ago, when he suddenly developed an increased thirst, craving cold water. The patient urinated very large amount of diluted water like urine with a specific gravity 1.0012 to 1.005. The patient is most likely developing. What is the condition? Endocrine disorders. Increased thirst. Okay, polydipsia. Craving for cold water. Urinate very large amount of diluted urine, polyuria. Okay, so diluted urine, low specific gravity. Okay, that is a specific gravity level is it is low. So what is the answer? Answer is diabetic insipidus, because the surgery is already patient is motor vehicle accident, so brain will be injured. So there will be the patient will be having the affected in the pituitary gland maybe. So that's why the secretion will be less, so diabetic insipidus can come. Okay, so got the point. B is the answer. Move on. If you just answer very quickly, we'll move on very fastly. Okay, we have few more questions. to discuss. Nurse provide the instruction to the client who is taking levothyroxine. The nurse tell the client to take the medication. Very easy question, right? Just answer quickly. Okay, on the empty stomach. Okay, we'll move on. Some questions are very easy, but you are taking so long to answer. Okay, here the next question. Home care nurse visit the patient diagnosed with the diabetic mellitus, whose current glucose is 150 to 200. Okay, so I have told you already, community question, half of them from the medical surgical based. Okay, so home visit nurse only going to the diabetic patient. So the 150 to 200 mg, it is the level of glucose. The patient has not been able to self-administer prescribed insulin and complained of blurred vision and the inability to read the marking on the syringe for the proper insulin dosage. Which of the following referral would be the most beneficial to the patient? Very easy question. What is the, from the question you have to take the answer. What is the problem in the question? They have mentioned blurred vision and inability to read the marking of the syringe. So what you have to refer, where you have to refer? And the ophthalmologist. Okay, the eye specialist, you have to refer the patient. C is the answer. Okay. Okay, next one. Post-operative parathyroidectomy. Okay, which client complaint would be indicate that serious life-threatening complication may be developing, requiring immediate notification of the physician. Life-threatening complication of parathyroidectomy post-operative. Okay, from down to up. Okay, one number answer. So everyone, so it is a laryngeal stridor. Okay, usually they will give you the hoarseness of voice. That is a symptom. Okay, remember laryngeal stridor, it is life-threatening. If the obstruction is done, no air is going to the lung. There is a respiratory distress come and life-threatening complication. Okay, so others are very small thing. Okay, so one is the answer. We'll move on. Everyone should be active. So next question. A patient is being followed in the clinic for the hypertension, adult onset of diabetes and obesity. Okay, hypertension is that, diabetic it is that, obesity is that. Okay, when you read the question itself, you have to clearly read. Okay, no, don't go to next time to read. Okay, so understand the question. The patient is apathetic about learning about nutritional guidelines to reach the goal of weight loss and consumption of the healthy diet. The patient admitted to the eating, okay, whatever is put in front of me. Which of the following action would be the nurse take? Okay, because he is not interesting about the nutritional guidelines. Okay, got the point? So whatever is put in front of the patient, they will be eating. So what will be the nursing action they are asking? Collaborate with the patient to set goals, add a nursing diagnosis of non-compliance, or refer to the psychiatric screening for the depression, discuss nutritional intervention with the spouse. Okay, as the nurse, what is the best one? Okay, collaborate with the patient to set goal also it is good, but now the patient only not doing that thing. Okay, right? But patient is whatever is putting in front of the patient is eating. So where you can be insert the nutritional, it is in the discuss the nutritional intervention with the spouse. So whoever making the food, they should be do with the nutritional intervention if you give to the patient's relatives, so they can do that food for the patient. Okay, got the point? So D is the answer. Some situation question, you have to be remember what will become. Okay, non-compliance patient referring to psychiatric and all we cannot do. Okay, so no, don't choose like that answer. Okay. Next one. The client is, there is so many questions from endocrines. Okay, different type of question. So this is a big topic. So try to take the key points. A client is diagnosed with the phenochromocystoma. Okay, the nurse prepare a plan of care for the client. While planning, the nurse understand that the phenochromocystoma is the condition that, what is the phenochromocystoma? Okay, it is the excessive catecholamine like adrenaline, noradrenaline. will be very increased. Okay, excessive catecholamine, it is a condition of phenochromocystoma. Okay, so the answer is 4, causes the release of excessive amount of catecholamine. Okay, got the point? Okay, so I have given you hyperthyroidism key point. You have to remember always hyperthyroidism increase T3, T4, but the decrease TSH. Remember, and the metabolism will be very increased. So they have weight loss. Don't forget this point. Okay, hyper T3, T4 increase, hyper metabolism, but decrease TSH and weight loss will be there. Hypothyroidism decrease T3, T4, but the TSH will be increased. Hypometabolism, patient will be having weight gain. And hypothyroidism, there is a heat intolerance. Hypothyroidism, cold intolerance. Okay, so these and all the key points, don't forget. Okay, so we'll finish this class with the endocrine question answer. I will be just discussing the urinary system and the eye question in the last revision class. Okay, so hope you understand. Any doubts, anything need to be asked.